Good evening, everyone. I'm Sayukta from Bladder Week. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic, overactive bladder. Overactive bladder, also called OAB, causes a frequent and sudden urge to urinate that may be difficult to control. The condition is common and distressing and may have a large impact on the quality of life. OAB patient feels to pass urine many times during the day and night and also may experience unintentional loss of urine, urgency, incontinence. To shed more light on the subject and guide us on what's right for diagnosis and treatment of OAB, today we have with us renowned urologist Dr. Pankaj Tejasvi. Dr. Pankaj Tejasvi, consultant urologist at Lala Har Bhagwan Das Memorial and Dr. Prem Hospital Private Limited, Panipat, Haryana. Dr. Pankaj has rich experience in the field of urology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very good evening to you, Dr. Pankaj, and we are really looking forward for a very informative session.
Good evening. Thank you for the generous introduction.
Thank you so very much. It's a pleasure to have you with us, Dr. Pankaj Tejasvi. And today, as we are going to talk about an overactive bladder, OAB. What is it, doctor, actually?
Actually, overactive bladder is a myriad of symptoms. Mainly, person has urgency and generally has frequency and nocturia. And about 30 to 40% patients of overactive bladder also has urge incontinence. Basically, bladder is an organ to collect urine. And when urine is adequate, around 250 to 350 ml or 400 ml, then involuntary contraction of bladder occurs and urination occurs. But in these people, even during the filling phase, when urine volume is not adequate in bladder, about 50 or 100 ml, involuntary bladder contractions occur. So person has to go frequently to the urination.
Okay. And why does this happen? Why this frequency or the urge to urinate so often?
Actually, their bladder becomes hyperactive. It has a lot of etiology. Basically, person comes with the symptoms of frequency, urgency, and nocturia. So it can be due to only etiology of unknown cause, or it can be due to UTI. Some cause is there, UTI is there. Some foreign body in bladder is there. Some neurogenic cause, like can be with diabetes or spinal cord injury. Bladder is controlled by central nervous system. So any stroke, cerebrovascular accident, cerebral palsy, and if some pathologies are there which cause obstruction of urine, like in males there is prostate, so benign prostatic hyperplasia or carcinoma prostate, or even with urethral stricture, some obstructive symptoms will be there combined with this irritative symptoms of overactive bladder. And one main reason of having overactive bladder is with aging. If we can't find any cause, aging is one of the reason.
Right. As you very rightly said that, in men, because prostate is there, and after a certain age, they many times, it's because it's very common, they do have, enlarged prostate issue. So they have the similar symptoms. Now with aging, again, people have similar symptoms. With diabetes, again, people have similar symptoms. They'll get on during night many a times to go to the washroom. Now the thing is that many a time people assume अभी तो एज हो रही है ये तो होगा ही, या मैं तो डायबिटिक हूं तो ये तो होना ही है, या इन मेल्स अगेन प्रोस्टेट इश्यू बहुत कॉमन है, हो सकता है मुझे हुआ हो तो ये तो होना ही है. तो ये जो होना ही है, ये तो होगा ही, इस तरह की जो बातें हम एसोसिएट कर लेते हैं ओएबी के साथ या इस तरह के सिम्टम्स के साथ, क्या सही में इसके साथ ही जीना होगा और इट्स ट्रीटेबल, इट्स क्योरेबल? व्हाट्स द सिनेरियो?
नो, इट एक्चुअली इट इज ट्रीटेबल. ये तो होना ही है वाली जो बात है कि एज के साथ बहुत सारी पैथोलॉजीज होती हैं जो जनरली आती हैं. ऑस्टियोआर्थराइटिस हो गया, ऐसे ही ओवर एक्टिव ब्लैडर है. सो दिस मींस यू हैव अ पैथोलॉजी व्हिच कैन बी ट्रीटेबल. So it's not advisable to not to visit a doctor and just sit and accept the symptoms. So you should visit a doctor whenever there is any symptom of overactive bladder.
Okay. And what are the treatment options available for OAB?
Actually, when patient comes with these symptoms of frequency, nocturia, and urgency, we have to first take an elaborated history and examination. We have to first rule out any causes. If we find any etiology behind the symptoms, like a person can have an UTI, then we will treat the UTI first. He can have any bladder outlet obstruction, we will treat the outlet obstruction. Like benign prostate hyperplasia, we will treat according to that. If we can't find any cause, then we will treat him according to that. It is purely overactive bladder and no cause is found. So we will advise lifestyle changes, medications, and further.
Right. As you said, doctor, that these symptoms are, or what we call overactive bladders, when we have urgency or frequency or nocturia, which I guess is when people go during the night to relieve themselves. इन symptoms को आप थोड़ा और elaborate कर सकते हैं किस तरह से हम frequency, urgency को
Actually, frequency is a very gray zone. It is a daytime urination, and if somebody is going every 3 to 4 hours, then it's okay. But if he has to go every 1 hour or every 2 hours, and it is bothering his lifestyle, is bothering his work or her work, then it is called frequency. Generally, it is more than 8 times. It is called frequency. And nocturia, generally more than 1 time is nocturia, but clinically nocturia, bothersome nocturia is 2 or more times. Because every time a person's wake up from sleep, go for urination and come back, around half an hour to 45 minutes of deep sleep is lost. So patient wake up very exhausted.
Right.
There will be consequences, and output of his work will also decrease.
Right. And leakage or incontinence is also associated?
Actually, around 20 to 40% patients with overactive bladder also has urge incontinence. It is the most bothersome symptom with which patient comes. Generally, patient don't come with nocturia and frequency alone in old age. They accept these problems. But when urge incontinence occurs, then generally patient visits the doctor.
Right. Again, these symptoms are very common in female, even if they have not reached a certain age still. I mean, middle-aged females also have this, these symptoms, and these symptoms are so overpowering that they restrict themselves from going out. मार्केट जाना है तो वो 10 बार सोचती है, अरे वहां पे कैसे हम वॉशरूम कहाँ मिलेगा, कैसे मिलेगा, नहीं जाना. They don't go to socialize, they don't go to public functions, etc. तो एक बहुत definitely their the quality of life is hampered. They are into so much of mental pressure and embarrassing situation कई बार उनके साथ हो जाती है. Why it's so common with females?
Actually, one of the more common cause in females, generally of middle age, it is UTI, because their urethra is so short. They have only 4 centimeter of urethra, whereas male urethra is around 20 centimeter. So it is very easy for the bacteria from outside to climb the urethra and cause cystitis. And one of the main symptom of cystitis and UTI is frequency.
Okay.
And also there, since the opening is just near to anal orifice, so the cross infection is also very common in females.
Right. And is there any way we can prevent having OAB?
OAB can be prevented. Like I said, there are different causes of OAB. Like there are different causes of frequency and nocturia basically. In females, you have to maintain hygiene. You have to drink adequate amount of water. And in males, actually, this UTI is very less common, but you have to follow a lifestyle that you have to avoid obesity. You have to avoid diabetes. This can be the only prevention of this.
Okay. Now you said it's important to have adequate water. Now we would also like to understand what's adequate water, and we would like to understand it more because we have this notion that we should drink as much water as possible. There is a lot of people who don't or won't drink water at all. People will have their family members will have to push them drink water, or there is a bunch of people who will have like even 4 to 5 to 6 to 10 liters of water in a day. They'll get up and have at least 1 or 2 liters of water at one go, and they said that's the way, we should have more water or as much water as we want. But you mentioned adequate, so please, doctor, if you can elaborate a little more.
Actually, in urological conditions, that is, stone is one of the most common urological pathology. In that situation, doctors advise to take plenty of fluids. But plenty doesn't mean that you have to take 5 or 6 liters of fluid. There is a mechanism in body which guides the fluid intake. You will feel thirsty if you drink less, but you should not drink over, because this also leads to many pathologies. Over drinking will cause polyuria, that will result in frequency. More amount of urine will be there. So it depends on person's work, what he is working. He is a labor or he is a software engineer, he is sitting, and it depends on climate. Like in India, in winter conditions, around 1.5 to 2.5 liter is adequate. In summer, 2.5 to 3 liter is adequate. But you should not over drink.
Okay.
And basically, if you have some symptoms of overactive bladder, you should avoid drinking after 6 p.m. because nocturia is the most bad symptom, because it is taking away around 2 hours of your life daily. You are just wasting not having a deep sleep, just lying on bed.
Right.
So you should avoid drinking more water after 6 p.m.
Okay, so adequate water is what we need to have. It depends on our lifestyle, on the weather, etc. If we are sweating a lot, our work style is such, then of course we'll feel more thirsty. Otherwise, what doctor said is the definition of adequate water. Now, with OAB, there are other things that we often say harms our body, like drinking alcohol or consuming alcohol or smoking, etc. Do they have a bad impact on OAB as well, or on the bladder as well?
Yes, alcohol is a diuretic. It causes polyuria, and smoking also is an irritant. It causes overactive bladder. Even spicy foods is also linked to overactive bladder. So if a person is having any of these symptoms, he should quit smoking and alcohol and avoid spicy foods. Even he or she should not take carbonated drinks, because it also causes polyuria. So his
Okay.
or her symptoms will aggravate.
Okay, so if we have these symptoms, then we should avoid alcohol,
Yes,
smoking, carbonated drinks,
yes,
spicy food.
yes, right.
Okay, right. And now the thing is, doctor, that with the whole urinary process, few organs are associated. As you said, bladder is there. In men, we can also associate prostate because it comes on, in the way. Kidney is there, which acts as a filter.
Mhm.
Now, if we have an overactive bladder and we keep on ignoring it or not getting it treated, then is there a possibility that the other associated organs will also get affected?
Yes, because overactive bladder is a symptom complex. It can occur with many of the diseases. Like if any obstructive disease is there, then there will be obstructive symptoms as well as symptoms of overactive bladder. So if
Okay.
patients keeps on ignoring, then bladder has to contract with lot of force against some obstruction. For first few months or first few years, bladder will contract and contract, and there will hypertrophy. But after that, some pressure of bladder will transmit from ureter to the kidneys. So there is a great chance of kidney injury. So one should not
Okay.
avoid these symptoms.
But the thing is, again, as we were, talking in the beginning, that people don't, protest or don't say that they have this issue. They just keep on suffering. They don't even share that they are going through this with their family members or their friends, etc. And they assume that it is now what they will have to live up with. Now, the thing is that if they don't do, if they are not talking about it to their family or friends or taking it to the doctor, then of course they are leaving it untreated. तो
Yes.
अनट्रीटेड अगर हम छोड़ दे, ओएबी को हम ट्रीट ना करें, डॉक्टर के पास ना जाए, घुटते रहे, खुद ही साइलेंस में सफर करते रहे, तो वो कितना बुरा हो सकता है?
See, this bladder is just a functional organ like heart. It has to work around the clock. So if you are hampering with the bladder function, then it will definitely after some time, after a few months, after a few years, it will get dysfunctional. And then to revert that disease pathology, it is very difficult. It will take 4 to 5 years to revert the pathology, and that also you cannot revert completely.
Right.
And then there is a risk of kidney injury. There is a risk of infection. If bladder is not emptying completely, then there is a risk of infection also.
Right. So if we have, or viewers, if you have these symptoms, that please don't ignore them. Then please don't neglect them. Anyways, you can't avoid them, right? Because you'll have to go to the
Yes.
washroom. You'll have to relieve yourself many times a day or during the night. So don't suffer in silence is what we are trying to, tell
Yes.
from this platform. Please go and consult your doctor and urologist in this case and get it sorted before it gets too late.
Yes.
कई बार डॉक्टर होता होगा आपके पास भी पेशेंट्स आते होंगे ये कहते हुए कि हम कई सालों से हमें ये सिम्टम्स थे लेकिन अब ये प्रॉब्लम्स हमें हो रही हैं और आपको लगता होगा कि अगर ये पहले आते तो बहुत इजीली ट्रीट हो जाता, अभी तो बहुत मुश्किल होगी। ऐसे में क्या आप अपने पेशेंट्स को समझाते हैं? व्हाट एडवाइस डू यू गिव देम?
इवन कई पेशेंट आते हैं, जब उनसे पूछते हैं कि सिम्टम्स कब से, वो कहते हैं 1 साल से, 2 साल से। तो पूछते हैं क्यों नहीं दिखाया, तो हमें लगा कि ये तो नॉर्मल है, ये तो होता होगा। इवन कई स्टोन के पेशेंट्स आते हैं, उनसे लीडिंग क्वेश्चन पूछते हैं कि आपको यूरिन में भी दिक्कत है, आप रात में कितनी बार जाते हैं, तो बोलते हैं हम 3-4 बार जाते हैं। बोलते हैं ये तो नॉर्मल है, ये एज के साथ होता है। ओके, इट कम्स टू मेनी पीपल विद एज, बट इट इज नॉट नॉर्मल। You should get it treated. You should go to a urologist. He will find out the basic cause. What is the cause? What is the reason behind it? Sometimes even now in India, very less patient comes for overactive bladder symptoms only. So whatever patient comes, 90 to 95%, there is some pathology behind it. Sometimes in males we find prostate, females we find UTI, or we find uterine prolapse.
Okay.
So you should visit a doctor.
Exactly, because there can be some underlying medical condition.
Yeah.
You are saying that okay, you are feeling frequent urgency of going to the washroom again and again, but maybe there is an underlying condition, medical condition. So it's always better to visit a doctor. Visit a doctor as soon as you see these symptoms, or as soon as these symptoms start bothering you. So please go and consult your doctor and urologist. दिक्कत ये भी है डॉक्टर कि जब भी हमें इस तरह की कोई दिक्कत होती है, और खासकर यूरिन से रिलेटेड या ब्लैडर से रिलेटेड, महिलाओं में भी पुरुषों में भी, वी रियली हेजिटेट टू टॉक अबाउट इट, वी रियली हेजिटेट टू गो टू द डॉक्टर। बेस्ट हमारे पास फिर क्या ऑप्शन होता है? या तो हम कुछ होम रेमेडी करने की कोशिश करते हैं, या फिर हम आजकल, क्योंकि बहुत सारे वीडियोस, बहुत सारे इन्फ्लुएंसर्स हैं जो अलग अलग विषयों पे बात करते हैं, उनको देख के उनको ऑब्जर्व करने की कोशिश करते हैं, या फिर हम ज्यादा से ज्यादा केमिस्ट तक के पास जा सकते हैं कि हमें इसका कोई इमीडिएट कोई रिलीफ बता दो, कोई फिक्स बता दो। बट ओएबी में भी होम रेमेडी या जो दूसरे तमाम चीजें हम करते हैं, ऑनलाइन सर्फ करना कि क्या किया जा सकता है, ये सब करने में जो टाइम वेस्ट होता है, तो क्या उसे वेस्ट करना वर्थ है, या फिर ये सब अवॉइड करना चाहिए?
नहीं, एक्चुअली ओवर एक्टिव ब्लैडर सिम्टम्स के इतने सारे कॉजेज ही हैं कि आप एक पर्टिकुलर थेरेपी यूट्यूब से देख के या कहीं से पढ़ के आप नहीं ले सकते। यू हैव टू फर्स्ट फाइंड आउट एंड रूल आउट द अंडरलाइंग कॉज। अगर आपको वो कॉज आपके पास, अगर आपको प्रोस्टेट है, आपको प्रोस्टेट कैंसर भी हो सकता है, आपको बिनाइन प्रोस्टेट हाइपरप्लेजिया भी हो सकता है, और आप सिर्फ मेडिकेशन ले रहे हैं ओवर एक्टिव ब्लैडर की, सो यू आर कॉजिंग अ वेरी हार्म टू योर बॉडी. It will lead to paralysis. It will lead to such a condition that it will take a lot of time to treat them. Early the better. If you come to a doctor early, it is better.
Right. Now, a person who is absolutely fine right now, who doesn't have any symptoms with like OAB, but he wants to avoid. See, सबको पता है कि एक एज के बाद complications शुरू होती हैं. तो ऐसे में अभी जो मे बी वो अपने मिडिल एज में है, कभी तक इस तरह के कोई सिम्टम्स नहीं देखे हैं, बट व्हाट एडवाइस वुड यू लाइक टू गिव देम सो दैट दे कैन प्रिवेंट देमसेल्व्स फ्रॉम हैविंग ओएबी इन फ्यूचर एज वेल?
Actually, only thing preventing the OAB is the fitness. You have to avoid diabetes. You should not have diabetes. You should not have obesity. If you are getting to postmenopausal condition, you should start low dose HRT. And if you are 50 plus male, then you should go for a screening test of prostate. You should get a serum PSA done. You should avoid alcohol and cigarette smoking, especially after the middle age, even if you are not having symptoms, because ultimately as aging increases, there is ischemia of the tissue, fibrosis of the tissue, and in women there is hormonal changes. So as age increases, risk of OAB increases. So it's better to change your lifestyle with aging.
And do you also advise for an annual or half yearly medical test in general, so that in case they have any issue with their prostate or anything else, they'll get to know about it? Regular scanning is important.
No, not there is no such regular scanning recommendation for OAB per se. But for
Mhm.
prostate, you can after 50 years of age, you can go for a serum PSA test.
Okay, right. We'll also take some of our viewers' questions. We have Sonia here with us asking, are there other lifestyle steps to take in order to manage OAB?
Regarding lifestyle steps, actually there is nothing like it will be a magic whatever you make lifestyle change, but it will definitely help. It will support the medicine also. And if you are
Mhm.
not having symptoms and you have a good healthy lifestyle, then it is unlikely that you will get a pure overactive bladder without any underlying cause. So in lifestyle changes, just be active, don't be obese, weight loss,
Mhm.
avoid smoking, alcohol, avoid too much spicy food, and regulate your sleeping cycles. And
Okay.
whenever you are going to bed, it is advisable to go to washroom and then go to bed,
Mhm.
because during night, even if you are going 2 times for washroom, it's okay for you, but it's not okay for the body. If you are sleeping 6 hours, then it is reduced to 4 hours of deep sleep.
Right. So it's important to take care of your health. It's important
Yes,
to have a healthy routine. It's important to eat right, to drink right, in the right quantity, the right things, and exercise right, and as well sleep right, sleep
yes,
well.
it's better to give your body a preferential treatment before it gives alarming symptoms.
Very well said, Doctor. We'll take a few more questions from our viewers. We have रजत सक्सेना आस्किंग, सर क्या अल्कोहल और सिगरेट से ब्लैडर में प्रॉब्लम आती है? हमने हालांकि ये डिस्कस किया, लेकिन हो
Yes,
सकता है रजत
alcohol
कुछ.
and cigarette says bladder main, even from head to toe, it is linked to varied pathologies. Already, although yet not to be directly linked, but it supports the pathology. So you should avoid alcohol and smoking.
Exactly. We have Namrata Singh asking, sir, if someone is leaking urine during laughing, does that belongs to OAP?
No, it is not overactive bladder. It is stress urinary incontinence, and it is generally due to weak pelvic floor muscles. But
Mhm.
on addition to that, she can also have overactive bladder.
Okay.
Both the symptoms can be there: stress urinary incontinence, leaking on cuffing, and frequency and nocturia both. So
Okay.
it is advisable to visit a urologist. He or she
Mhm.
will examine and then treat the conditions accordingly.
Pelvic floor weaken होना women में especially after postpartum, और क्योंकि वो
Yes.
बच्चे को जन्म देती है, तो ऐसे में ये कंडीशन अगेन बहुत कॉमन हो जाती है. तो चूंकि आपने pelvic floor मसल का जिक्र किया, क्या हम जो अलग-अलग एक्सरसाइजेस बताए जाते हैं रेगुलर रूटीन के तौर पे भी उन्हें महिलाओं को करना चाहिए आफ्टर अ सर्टेन एज, भले ही उनको अभी ओएबी की कोई दिक्कत ना हो, कोई सिम्टम्स ना हो, लेकिन क्या वो एक्सरसाइजेस किए जा सकते हैं?
Yes, actually, with aging, pelvic floor muscle get fibrosed and weakens in both male and female. But
हम्म.
in female, there is an additional disadvantage that when they are in labor, when they are pregnant, then due to hormonal effects, due to compression from the fetus during the delivery, there is
हम्म.
more chances of pelvic floor injury and pelvic floor muscle weakness. So it is advisable to for especially for females, if they don't have any symptoms, then also they do pelvic floor strengthening exercises. These are a myriad of exercises called Kegels exercises.
Right. So Kegel exercises can
Yes.
be tried that, and right. And again, with women who are pregnant, these symptoms like frequency, urgency, leaking, these are very common. Now, again, is this related to the pregnancy because there is a lot of pressure on the bladder because of the fetus, or anything else?
No, it can be related to pregnancy, frequency and nocturia. But if
Mhm.
she is having burning micturition or she is having fever, even if she is very having bothersome frequency and nocturia, then she
Mhm.
should visit a urologist, because if by chance she has a UTI, then UTI
Mhm.
is very lethal in pregnancy. So you
Okay.
should always consult a urologist if you have any bothersome symptoms during pregnancy.
All right. We'll take a few more questions. Okay. Now, Shivani Mishra is asking, does the medication of, OAB have side effects?
Yeah, there are a few medications like solifenacin, derifenacin, mirabackground. They have their individual side effects. So we don't recommend medication at a full dose from the very starting. First, we have to rule underlying pathology. If pathology is not there, then we will advise for lifestyle changes. If person is not improving from lifestyle changes, or if person doesn't want to accept the lifestyle changes, then we start on medication at a low dose. If he
Okay.
or she doesn't improve, then we increase the dose. And if after taking around 3 to 6 months of medication, if somebody improves and he or she wants to quit the medication, then also we can give a few months of drug free period.
Okay. Right. But the more emphasis is on lifestyle modifications,
Yes.
right? So that we can, combat or restrict these symptoms by doing some modifications in our lifestyle, which is morely eat well, sleep well,
Yes.
work out well, be active, and drink well and drink the right things. We have Radhika Shukla with us asking, सर क्या यूरिनरी इनकॉन्टिनेंस स्ट्रेस की वजह से भी होता है?
No, mental stress की वजह से यूरिन incontinence नहीं होता, but mental stress is directly or indirectly related to various of urological pathologies, including the bladder function also, but it will not directly cause incontinence.
सबरी नाथन है, डायबिटिक है और पूछ रहे हैं कि चूंकि अब डायबिटिक पॉपुलेशंस बहुत ज्यादा हैं एंड डायबिटीज की वजह से भी ये प्रॉब्लम हो सकती है, आपने कहा है, तो इससे कैसे निपटा जा सकता है?
एक्चुअली अगर किसी को डायबिटीज है तो ऐसा जरूरी नहीं है कि उसको ब्लैडर की प्रॉब्लम हो या और भी कई सारी प्रॉब्लम्स हैं। डायबिटीज जरूरी नहीं है कि प्रॉब्लम्स हो। अगर डायबिटीज आपकी कंट्रोल में है, आपका ग्लूकोज लेवल शुगर में ब्लड में नॉर्मल है, तो इट विल नॉट हार्म द नर्व्स। तो अगर आपकी डायबिटीज कंट्रोल में है तो इट इज वेरी लेस लाइकली कि डायबिटीज की वजह से आपको ओवर एक्टिव ब्लैडर होगा या कोई भी न्यूरोपैथी होगी। सो बेटर टू कंट्रोल योर डायबिटीज मेडिकेशन, नॉट टू जस्ट ऑप्ट फॉर एनी XYZ medication for 1 year and then check your glucose. It's better to have a strict control on glucose level.
Okay. दीपक उपाध्याय पूछ रहे हैं, does OAB lead to UTI? आपने कहा UTI की वजह से OAB हो सकता है या symptoms हो सकते हैं, क्या OAB की वजह से UTI हो सकता है?
Actually OAB just is a symptomatic definition. So अगर किसी को नॉक्टूरिया फ्रीक्वेंसी है तो उसको ब्लैडर आउटलेट ऑब्स्ट्रक्शन हो सकता है, उसके साथ और भी सिम्टम्स होंगे। अगर किसी को ब्लैडर आउटलेट ऑब्स्ट्रक्शन है तो उसका पोस्टवर्ड रेसिडुअल वॉल्यूम, मतलब पेशाब करने के बाद जो ब्लैडर में यूरिन बच रहा है वो ज्यादा अमाउंट में बचने लगेगा। तो अगर वो स्टेसिस है, यूरिन कई देर तक रहता है, तो उसमें इन्फेक्शन होने के चांसेस बढ़ जाते हैं।
कई लोगों के साथ ये भी होता है कि वो बार बार वॉशरूम जाते हैं बट उनको लगता है कि अभी भी पूरी तरह से उनका ब्लैडर क्लियर नहीं हुआ है या बाहर आया, फिर लग रहा है कि नहीं 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 हुआ है, वापस जाते हैं। तो अगेन आई मीन दे शुड बी रियली
that is also due to the same thing, that there will be increased PVRV, post residual volume. They can't empty the bladder full because of the obstruction.
Right. श्याम सिंह पूछ रहे हैं, कैन सर्टेन मेडिकेशन और पेल्विक और एब्डोमिनल सर्जरीज कॉज OAB?
OAB is less common, but yes, some pelvic surgeries in which nerves are injured, that mainly leads to underactive bladder, but overactive bladder can also occur.
Okay. Now Ram Sen is asking about pelvic floor muscle exercises. Are there exercises that can strengthen pelvic floor muscles to help with incontinence related issues? We have already spoken about it, but still if you would like to tell us.
Actually, pelvic Kegels exercise, it looks very simple when you watch on any YouTube media or something, but it is very difficult for a person to identify the pelvic muscles. Whenever generally patient comes that he says that I am doing this exercise but I am not improving, generally he is not contracting his pelvic muscles, he is contracting his gluteus maximus, he is contracting his abdominal muscles. So it is very necessary to identify the pelvic muscles. You go to a urologist or you go to a physiotherapist. He will or she will help you to identify the pelvic floor muscles when you are exercising. He will teach that while doing this, these are the pelvic floor muscles and these are the muscles you are contracting wrong. Because even if you are exercising wrong, there is no use of that.
So exercising the right way is very important. Otherwise,
Yes.
there's no use, or you may end up, harming yourself more. So it's better to go and consult a trainer, a fitness trainer, and then do it under their
Yes.
supervision. Amitesh Tiwari is asking how many chance of OAB in youngsters aged between 20 to 30 years?
20 to 30 years, if OAB is there in female, then generally
Mhm.
the most common cause is UTI. And if it is in males, then generally it is due to if early diabetes, which is very rare, or it can be due to any foreign body like stone in bladder or stone in ureter. Rarely it can be UTI in males, but purely OAB is very rare in 20 to 30 years.
Okay. Niranjan Reddy is here, doctor, asking daily having 4 to 5 cups of coffee, is it going to cause OAB?
Actually, there is no direct link that is going to cause OAB, but
Mhm.
uh, 4 or 5 cup of coffee, anything excess is not good, not advisable. And if you have any symptoms, even slight symptoms of OAB, then you should completely avoid coffee and tea.
Okay. And caffeinated drinks like coffee, etc., I mean, they are okay or they do irritate bladder?
No, this somewhat irritate bladder, and they are also diuretic. So they also increase the volume of urine.
Okay, exactly. When we drink water, or when we think of, keeping a track of water, what we normally do is
Yes.
we count our water intake.
Yeah,
We
you
don't
should count your fluids.
fluid intake. So
Yes.
coffee, tea, etc. is actually, combining, you are actually ending
Yes.
up drinking a lot. We have Sebastian R asking, is OAB fully treatable in old patients?
Actually, OAB is a very chronic disease. It settles very slowly,
Hmm.
and it will be get treated very slowly. And I can't say that it can be cured completely if there is some cause like prostate, or if stricture is there or UTI is there, then it is completely curable. If no cause is there, idiopathic OAB is there, or it is due to aging, then we can decrease the symptoms. It will come to a state when patient is not bothered about the symptoms. Very less nocturia. Before he is having like he has to go 7 times in night. Now he is going 2 to 3 times. He is going every hour during day. Now he is going after 2 to 3 hours. Then it will be just, we cannot cure 100%.
So that's why we are continuously saying that in case you have these symptoms, please visit your urologist as soon as these symptoms, you understand you're having these symptoms, or they are bothering you. Now, many times people do ask what's normal, what's not. I mean, they don't even realize that if they are going to the bathroom, that's frequent or not. So, would you like to shed some light over that, doctor? What's normal? I mean, how many visits to the washroom or to the loo is okay, and what's not normal?
Actually, during daytime, if you are going after every 3 hours, 3 to 3.5, it's okay. It's all right.
Mhm.
If you have to go every 1 hour, if you are going every 10 minutes, you are going every 1.5 or 2 hours, it is counting more than 8 times during day, then it is considered frequency. And night time, if you have some party and something and you have nocturia in one day, in one episode of nocturia, then it is all right. But if
Mhm.
regularly every night you are going 2 to 3 times, then you should visit a doctor.
Fair enough. We have Naman Reddy asking how many liters of water would you recommend for an OAB patient?
For an OAB patient, it's just as adequate as possible. Don't have to drink when you are not thirsty.
Mhm.
Even if your creatinine level, your kidney is normal, 1.5 to 2 liters of water is enough. If you are not sweating a lot, if you are not in a very hot climate, don't
Mhm.
drink more than 3 liters of water.
Okay. And doctor, you said while we were discussing the treatment options that there is lifestyle modifications that's to be done. If that doesn't work, then medication is there. Both of them are there to do,
Hmm.
to go hand in hand. And if nothing works, then is there any surgical procedures to combat this issue?
See, if you have any pathology like prostate or any obstructive pathology, then we will remove that obstruction. We will remove
Mhm.
the prostate. You will treat the stricture. If you have uterine prolapse, we will treat the uterine prolapse. But if you can't find any cause and symptoms are not improving much with both the lifestyle changes and medicine, then we can do sacral nerve stimulation, or we can put Botox in the bladder. Both
Okay.
Botox works for 2 to 3 months. Sometimes it works for 6 months also. And slowly and slowly, with lifestyle changes and medication, patient will cope up with this.
Okay, so these other techniques or procedures are also there. Suman is here asking, sir, क्या daily walk और exercise करने से ये problem खुद ठीक हो सकती है? अगर डॉक्टर के पास नहीं जा पाए तो खुद से ही lifestyle modification करके ठीक हो सकती है problem?
नहीं, जैसा मैंने बोला, lifestyle, it is a chronic disease. If you are having symptoms now, disease must have started. If no underlying pathology is there, disease must have started 2-3 years back. So it will not be treated in just a few months or few years of lifestyle modification. So you should visit a urologist once, let him or her find out any cause is there. If everything is okay, then you can continue for lifestyle changes.
Right. तो जैसा कि हम कह रहे हैं कि हो सकता है कोई अंडरलाइन इशू है, कोई
Yes.
अंडरलाइन मेडिकल कंडीशन है, तो इसके लिए डॉक्टर को दिखाना बहुत जरूरी
Yes,
है कि
yes.
आखिर ये सिम्टम्स हो क्यों रहे हैं.
Yes.
तो इसीलिए सुमन, आप लाइफस्टाइल मॉडिफिकेशन कर रहे हैं, ये बहुत अच्छी बात है, लेकिन डॉक्टर को भी दिखाइए, तुरंत दिखाइए. Kishore Mishra is asking, are COVID patients vulnerable to OAB?
Not proven like that कि COVID virus is just directly stimulating the detrusor or like that. So there is no much relation from COVID and OAB.
Okay. Varun Jain ने एक सवाल पूछा है, does dehydration cause incontinence?
No, dehydration will never cause incontinence. Dehydration can lead to low urinary output and concentrated urine. That can lead to stasis of bacteria and UTI, but it will not cause incontinence.
Exactly. Namisha Gupta पूछ रहे हैं, what are the side effects of long-term medication of OAB?
Actually, OAB, there are two classes of medications. Like solifenacin, derifenacin is one class, and mirabegron is another class. So there is not much side effects of mirabegron, only some heart-related side effects are there. So we avoid in hypertensive patients. And solifenacin, derifenacin, some dry mouth and dizziness and like these symptoms are there. So even for 1 year or 2 year medication, there is not much side effects. But before taking medication, we have to rule out that medication is advisable in this patient or not. He is having any pathology or not. If you can't find any obstructive pathology, you can't find any anatomical pathology, and then you can prescribe medication.
Exactly. I'm sure डॉक्टर बहुत सारे पेशेंट्स, बहुत सारे हमारे व्यूअर्स हैं जिन्होंने OAB टर्म आज पहली बार ये सेशन सुनने के बाद उनको पता चला होगा कि ओवर एक्टिव ब्लैडर होता है, या जो उनको सिम्टम्स हो रहे हैं वो उसको एक वर्ड, एक टर्म दे पा रहे होंगे कि ओके, मेरे जो सिम्टम्स है ये शायद ओवर एक्टिव ब्लैडर के सिम्टम्स है. तो ऐसे में वो लोग जो अभी तक साइलेंस में सफर कर रहे थे, those who were suffering in silence, those who had these issues but they never come up with the problem or talked about it, और डॉक्टर के पास जाना तो बहुत दूर की बात है. या कई बार होता है कि हमें वो प्रॉब्लम नहीं है, लेकिन हम अपनी फैमिली में दूसरे मेंबर्स को देख रहे हैं कि वो रात में बार-बार उठ रहे हैं या दिन में भी बार-बार जा रहे हैं, तो एटलीस्ट वी as a family member or friend can also keep a track और बात कर सकते हैं. एटलीस्ट सेशन से ये एक अवेयरनेस भी हम जगाने की कोशिश कर रहे हैं कि आपको नहीं है लेकिन आपके पास की किसी को है, तो आप उनसे बात कीजिए, उन्हें बताइए कि ये ट्रीटेबल है, लेट्स गो एंड कंसल्ट विद एन यूरोलॉजिस्ट. तो ऐसे जो हमारे तमाम व्यूअर्स देख रहे हैं और आज उन्हें पता चला है कि ओके, हो सकता है जो उनके सिम्टम्स है वो OAB के लिए है, या हो सकता है कोई अंडरलाइंग मेडिकल कंडीशन है, क्या उन्हें आप एडवाइस करना चाहेंगे, उन्हें क्या करना चाहिए?
एक्चुअली ये समझने की जरूरत है कि अगर देयर इज अ ग्रुप ऑफ 100 people and 99 people are coughing, then you can't say that it is normal. So if all aged persons, maximum people are having urinary complaints, they are having frequency and nocturia, then you should not consider it is to be normal. You should compare your health from when you are young, you are adult. That time you are not having any complaints, so why should now you have complaints? There is some problem in the body, you should visit a doctor for that.
Right. Very well said. तो हो सकता है कि आपने ये मान के आप बैठ गए हों कि ओल्ड एज के साथ ये प्रॉब्लम है, लेकिन अगर प्रॉब्लम है तो उसका कोई रीजन भी होगा, उस रीजन को, उस कॉज को पता करना बहुत जरूरी है, जो आपके लिए करेंगे doctor. So please consult कीजिए doctor को. And doctor, before we sum up the whole session, any take-home message for our viewers?
Basically, message is if urinary problems is much more common, I think, than diabetes in old age peoples. But people are not visiting, especially females are not visiting the doctors. There is some problem from gender bias of doctors. Also, there is very less number of female urologists in India. Even in the world, very less female urologists is there. But you should not ask your friends, your colleagues that she is having that symptom, I am having that symptom, then it's normal. If you are having any symptom that you were not having 10 years, 12 years back, then you should visit a doctor always.
There's it's not worth to taking risk with your life. तो कुछ भी problem है urinary tract से related भी कुछ अगर problem है, OAB के symptoms हैं, please don't hesitate, please come up, don't suffer in silence is what we would like to say. Yeah. Thank you so very much, Dr. Pankaj Tejasvi, for your valuable time, sir. And it has been a very informative session for our viewers. And we really look forward for many more such sessions in the coming times.
Okay, thank you.
It was a pleasure having you with us. Thank you once again. Viewers, thank you for an excellent participation. And for more information and updates, stay connected on our FB page, Bladder Wellness. We are also available on YouTube.